Just to start off, for our readers who are unfamiliar, as the Director of Strategic Communications for Planned Parenthood of the Rocky Mountains, can you describe what your position entails and what the most popular services provided at PPRM are?
So my position is really telling the story of what Planned Parenthood of the Rocky Mountains does to all of the audiences that need to know that information. So I oversee the conversations that we have with folks like you in the media, our digital presence with our followers and our patients, and really help to make sure that all of the work that we're doing, all of the activism that we're involved with, and just everything that we're doing to provide and protect reproductive rights, all of those stories are getting out there, and that people are able to access healthcare and know what they need to do in order to help us to protect that care.
And how many locations does PPRM have?
We have 24. We have 18 in Colorado, 4 in New Mexico, and 2 in Southern Nevada right now.
So in broad terms, how is the coronavirus pandemic impacting PPRM's provision of health services right now? To what extent are your clinics across the region being impacted in similar ways, or are you seeing differences state by state in the experiences of your clinic locations across Colorado, New Mexico, Southern Nevada, and Wyoming?
It's really interesting because on the one hand, the pandemic is impacting everyone and everything, every type of business, every healthcare provider, every individual and every family. And so you're seeing impacts everywhere, but certainly they look different depending on who or what you're looking at. For us, it has really made us shift a little bit how we are providing our care and lean into some of the ways that we've already kind of been pivoting a little bit more than we maybe have been in the past. So what I mean by that is certainly we have changed the way that a patient comes in and gets their healthcare in our health centers. We are incorporating physical distancing to the extent that we can in our waiting rooms. We're doing a lot of our intake remotely so that folks can do as much of the visit remotely as possible, except for whatever actually physically has to happen in the health center. So taking those histories, having those conversations, trying to do as much of that remotely as we can. We, for a time, were really prioritizing time-sensitive, urgent types of appointments, and really just making sure that if you are leaving your home, you're doing so because you absolutely have to, knowing that across all of our region, our states, for a time at least, were under stay-at-home orders, and we were working within those orders. And we've really been leaning on telehealth, which is something that we had already been doing in different ways. And we have kind of just ramped that up and really tried to shift folks to those services if those are options for what they're looking for, so that we can make sure that we are still able to provide care that people really rely on, no matter where folks are and no matter what's happening with the pandemic.
Yeah, that's really great. Thank you. I definitely want to come back to telehealth later in the interview as well. But just as a starter, I'm also wondering, in the midst of the pandemic, a lot of states have taken action to effectively ban or severely restrict access to abortion. So just last month, NPR reported that an abortion ban in Texas was leading to an influx of patients in Colorado, Nevada, and New Mexico. Can you speak to what this influx of patients has looked like on the ground for your clinics and how PPRM is working to address the needs of these patients?
Yeah, on the ground, it looked like I think we had less than 20 patients from Texas come to our health centers in our Rocky Mountain region in February. And by the time I ran the numbers for April, it was over 200. So that really shows you that what's happening in the state legislatures has a direct, tangible impact for patients and for people's lives. People came to us when they couldn't access healthcare at home, and that's something that for our region, we've seen that dynamic in action in the past. Anytime a restriction or some kind of complication is put into place that prevents somebody from accessing care, the Rocky Mountain region is often considered a safe haven for care. We are able to see patients. We don't have a lot of restrictions that make it so that people have to kind of jump through hoops and do all these unnecessary additional steps just to get the healthcare that they're trying to access. And that's been real for us even before the pandemic. But as you can see from the numbers that I just cited, even more so when a neighboring state is imposing a restriction, we see the patients coming in, and it's up to us to serve them. We are intent on, we recognize our status as kind of a safe haven region for reproductive health care. We're intent on protecting that for our patients locally and for those beyond our borders as well.
Going back to your comment about telehealth and building on this question about abortion. So currently demand for abortion by telemedicine is also surging. So what's it been like for PPRM in Colorado and New Mexico as a teleabortion provider at this time? And to what extent have your clinics been experiencing the overall increase in teleabortion demand?
Yeah, there has been an increase, and I don't have those numbers offhand, but I'm happy to provide those to you in a follow-up because I know that there has been an increase in interest. We participate in a teleabortion study, and so some qualified patients are able to access medication abortion remotely, completely remotely from the comfort of their home or wherever it is that they are. And I know that there has been increased interest in that, and folks coming to our region in order to be able to access that, because that's not something that's necessarily available everywhere. And so we're definitely seeing that way of accessing care, the interest in that has really grown. The other thing I'll also mention is that we had already in existence what we call our PP Direct app, where folks could access birth control or UTI treatment using an app. So they're contacting us with an app, they're filling out some information, we've got a clinician looking over their information, and for those who qualify, we're able to either mail birth control to their home or send a UTI treatment prescription to the pharmacy of their choosing, and they never have to come in, they never have to leave the house. And so those are the types of offerings, and as we kind of navigate like a post-coronavirus world, you know, I anticipate those types of offerings will be in higher demand, and even more services will become available through telehealth. It's really kind of the way of the future, and it's something that's really important to us, because one thing that's a real mission for us is to meet our patients where they are and to make healthcare as accessible as possible, to remove barriers to access as much as we can. And so telehealth has been just an amazing way to really do those things, and just has not been more critical really than it is in this moment right now.
It's really interesting. And going back to the idea of there being maybe increased barriers to access to medication and reproductive health care right now, to what extent do you think that changing policies around abortion access is a feature of the moment versus indicative of a long-term trend? And what does preserving women's access to abortion look like during the pandemic and going beyond, thinking about the future of telehealth and telemedicine?
Yeah, that is a really interesting question, because it's really both things. You know, we always say Planned Parenthood has been around for over 100 years. Our affiliate has been around for over 104 years, started in 1916. And we've seen our ups and downs. We've seen attacks on healthcare. We've been through administrations and local legislatures that are really friendly, and those that are just really opposed to letting people access reproductive healthcare. And so it's kind of been a back and forth, and we've navigated through it all. For us, it's something that we intend to be here for our patients no matter what. We always say we're here no matter what, and that's really something that's true to our hearts. And so I think it's both. You know, the attacks that we're seeing on reproductive health care are something that we've really navigated constantly. And in the last several years, we've seen an enormous number of restrictions coming about in neighboring states and throughout the country, trying to limit abortion care access. So it's not new, but I do think that it's pretty clear to us that this pandemic and this moment in time is also being used for a political agenda. to further a political agenda and we simply can't allow that. We worked very closely with the governor's offices in the states in which we operate, and we made sure that it was understood, and we had really wonderful relationships with those offices to make sure that that care was understood as essential. It couldn't wait. It's time sensitive. And so we really have been able to work in our region to secure the availability of reproductive health care. But it's not lost on us that other leaders and other states are using this as an opportunity to further an agenda that takes away our ability to decide what to do with our bodies.
Looking beyond the current pandemic, I'm curious, what do you think will be the biggest takeaway for PPRM in terms of the role that it's playing as a provider of and an advocate for reproductive health care and rights?
That is also such a beautiful question. I think so. Certainly, I know that there will be incredible lessons learned from what we are experiencing right now. And I also know that we do not anticipate the world necessarily looking like it did before. And so I think the biggest takeaway right now for us will be that we will learn from having listened to our patients and having listened to our communities and being able to respond in how we provide services and how we reach them and how we provide the education that we've been providing for so many years in the ways that we engage in advocacy and in the types of advocacy that we provide. We will learn from our communities what is needed, and we will pivot just like we always have, and we will shift our strategies because ultimately our patients are at the heart of everything that we do. And so we will learn from them, and in the new normal, whatever that may look like, our goal is to always meet their needs, even as those things change and look different.
Well, that was all my questions. Thank you so much for speaking with me. Before we end, is there anything else you want our readers to know?
I think I would love for the readers to just know that we are still here. Our doors are still open here in the Rocky Mountain region, and I know that a lot of Planned Parenthoods across the country would say the same. We're seeing shifts in what things are looking like on the ground, but our goal has always been and always will be to meet the needs of our communities, to be here for our patients, and to provide the highest quality care that we know our patients deserve and look to us for. So we're here, and I would also just say, reproductive health care, including abortion care, is essential care. It can't wait, and it's essential care. It is healthcare, and healthcare is a human right, and never have our human rights been more important. So just know that Planned Parenthood is standing up for that, and we're standing with our patients, and we're here.